What's up, Smashers? It's an awesome day. That's Monday, right? It's Thanksgiving week. We got a bunch of workouts going on in the background, so I won't try and talk too loud. But I'm going to be talking about, well, how about this? A trochanteric bursitis. How about just hip bursitis, right? Fancy word for it. But the problem is and I realize I'm bouncing around back here, but I'm kind of tucked in the back. I don't want to disturb anybody in a workout. But it's misdiagnosed, and the cause of it is not... Here, let me put this here. I sound like Gru. And by the way, if you guys haven't seen Despicable Me, it's funny because he says, it's not. So anyway, the cause of it is not a lack of corticosteroids or a lack of Advil or any of that nonsense. It's a problem with mechanics, probably 9 out of 10 times. So the problem with the mechanics is the pelvis is usually weak, imbalanced, and same with all the muscles controlling the femur and that hip, the glutes, all that stuff gets super weak or super imbalanced, and it starts to rotate that, it rotates that femur, and then that greater trochanter starts to rub on that. It's like a plastic bag filled with fluid that allows sliding surface, especially a bony prominence like that, that allows it to slide underneath the muscle without causing any problems. Now, if you're doing repetitive sports, like something where it's just constantly doing that over and over and over again, yeah, you're going to irritate it. It's like if I grab my hand and I start grating my knuckles across it, eventually it's going to cause a little bit of a problem, cause a blister and an issue. But the dilemma is fix the mechanics of the pelvis. 9 out of 10, I'll go 99 times out of 100 that trochanteric bursitis, that hip bursitis, that pain right here is gone. And here's the problem. Is it's not treated that way. They start bombing you with corticosteroids, which we already know don't do anything for healing. They actually cover it up. Lidocaine, corticosteroids, all goes in there, slows down the healing process, and then causes a bunch more issues. So we're going to kind of avoid that. I'm just going to show you how to fix it. So we're going to strengthen up the pelvis and then unload that hip so it works the way it's supposed to. There's 2 stretches and three basically strength drills. They're going to help a ton. We have to basically unload that TFL, unload the anterior portion of the leg, anterior portion of the compartment. So primarily that rectus femoris, because it comes off of the top off of the AIIS, right, the front of the pelvis. And then the entire hamstring, that whole posterior chain, needs to be unloaded so that pelvis has some freedom to move around, so that ball can sit there and slide around and move around in that socket instead of grinding away and ratcheting around and having that pelvis being all torqued. So that femur winds up rotating forward and grinding away on the inside of this. Just turns it into hamburger. That just sucks, doesn't it? All right, so check this out. First things first, I got my trusty, I actually bought a camera stand this weekend. Yeah, I really did. I did. I'm gonna show you one day. Right now, I'm not using it though. I'm using a collar. So you're gonna take a band. So it's this is a light band. So you're gonna take a band. I have it loaded up on the GHD, but you're just gonna get the outside leg. So if you have I want you to do this for both sides. Start with the affected leg. So if I have some bursitis issues right here, remember I'm gonna have pain here. If I'm sitting for a long period of time, it's gonna start to act up. All that stuff, I'm gonna stand up, it's gonna hurt. If I go for a run, it's gonna hurt. All this stuff just starts to act up here. It can even radiate pain into the glute and down to the hamstring. Actually, one of my friends over there, Kyle, he's had this issue, so he knows exactly what I'm talking about. But you wanna load it up. You're gonna straighten out that leg on the bottom. And so the band is dragging me this way. So all I'm gonna do is I'm gonna let it pull me over and then pull it all the way open. So let me get a better picture of this so you guys can see exactly what the shiz I'm doing. Looking like a close-up of SmashweRx face. Good, so you can see I got the band here, right? So the band is dragging me this way. I'm gonna load it up pretty solid. So I'm gonna load that up. This leg straight, this is the affected leg. I'm just gonna have it bring me over until the band goes slightly slack, and then I'm just gonna pull it open. So I'm not going for a super wide range of motion. I'm moving maybe 30, 40 degrees, but I wanna work on this opening and closing that hip, and we're gonna do, remember what I said? I'm a 3 set of 10 kind of guy. So you're just gonna do this. This is gonna help strengthen that lateral portion, all those external rotators, super important. That's number 1. Good. I know, super funky stuff, right? This is where all the fun stuff comes into play. And if we don't do this stuff, it doesn't work. Okay, that's number 1. Number 2 is just a simple bridge, but it's got a rotation in it. So we're gonna sit back like this. And what I'm gonna do is I'm gonna be reaching back and over with this hand and back and over with this hand. So I'm gonna bridge out, and then I'm gonna reach all the way over and then come all the way back. I'm gonna do the same thing on this side. All the way over, all the way back. So all the way back, all the way back. So that's gonna help work the glute, and it's independent of each other. So we're working on symmetry. 3 sets of 10, that's number 2. Number 3 is, normally I do this one with a band. I don't want to band in this one. So we're just gonna take the leg, cross it over. Be careful on this one. because this is gonna load up that bursa a little bit. So you're just gonna take this. All I'm gonna do, no band this time, and we're just gonna let it fall all the way to the side. Unload that. How long do we stay like this? 2 minutes, right? That's it. Super easy. Once you're done, do the other side. Everything I'm giving you is for both sides. That's super important. And then the last two, this is where the fun stuff starts. Last two is gonna be, so we've unloaded the TFL. We've worked on strengthening the glutes. We've peeled away and opened up that set of set of adductors and everything in the center, and worked on that external hip rotation. And then the last two, check this out. Super important stuff. An oldie but a goodie. We're gonna get over here. So we want to unload. Remember what I said, rectus femoris runs right down the front. So you're just gonna take the leg. I'm all the way against here. Now remember, this couch stretch, and I'm gonna move the phone so we can see just a little better, because I know, mad camera skills. I'm just sick, huh? I got a bench up front here, and I'm kind of tucked off in the corner just for a reason, because I don't want to disturb a class. But we're gonna get like this, post out on this leg, and then all we're gonna do, so I'm gonna squeeze my glutes. I'm gonna push this part of my hip forward, so all this crispy just bacon in here, and I'm just gonna hang out like this. What's not a couch stretch is this one. So just hang out like this. Push yourself back, hang out for how long? 2 minutes. That's what, number 4? Last one's super easy. You can see there's a wall here. I'm gonna show you that you can do this shadizzle anywhere. This is the coolest part. Check this out. Bottom leg straight. Tuck in like this. What you wanna have is this portion of your low back flat against the floor. I don't want this bent either. So foot, totally dorsiflex, hang out all the way against here. How long do we hang out like this? 2 minutes. This is gonna unload the hamstring, the calf, part of the glute, peel away that ischial tuberosity, that high contact point, that high connection of the hamstrings that all come in there. 3 out of the 4 attach on that ischial tube right at the bottom of the pelvis. It's gonna unload that pelvis. That way that femur can rotate out again, because the problem is that femur gets dragged into internal rotation, and then it gets stuck like that, and that greater trochanter, that outside of the femur, that bony tooth that sticks out, just starts to grind away like a rasp on that bursa. And you know what it does? It sucks. So how long do we hang out like this? 2 minutes. When we're done, bend it, unload it, and that's all she wrote. Hey, listen, that is hip bursitis. That's how you get rid of it. That's how you prevent it. I'm Trev, SmashweRx. I'll check you guys out tomorrow. Have an awesome day.